right, welcome back to Get Some. Joining me right now is Dr. Lawrence Yore, a urologist, and we're going to talk about low testosterone, ED, and some other really important issues like that. Dr. Yore, thank you so much for joining us.
Oh, thank you for having me. It's great.
Okay, so let's start off with low testosterone. Give us some of the causes in men.
Well, low testosterone historically hasn't been that well known, but we're learning more and more about it. And the main reasons would be if you've had trauma, because the testicles manufacture testosterone. So if for some reason you were at the wrong place at the wrong time and you lost a testicle from trauma, or when you may have had a hernia when you were a child and lost a testicle, or had mumps, which can affect. So anything that would affect the testicle would decrease the amount of testosterone you produce. So that's one cause. Other causes could be from toxic chemicals, Agent Orange or things like that. So some guys who are in the military have low testosterone from exposure to certain chemicals. So those are some of the obvious causes.
Okay. Is it just something that happens as you get older? Because you hear all these TV commercials and they sort of scare the life out of you.
Well, the TV commercials are commercials, and the science is a little different from the commercials. But no, the testosterone level does drop as we get older. Probably starting at age 30, hate to tell you.
I'm only 22. I don't know what you're talking about, man. I still got plenty of time.
But starting at age 30, it can go down about 1% a year. But we all start out with high levels. The other thing that can be confusing about testosterone is that it's not a constant level. There's a bit of what we call a circadian rhythm, so that the testosterone level usually is higher in the morning than in the afternoon. So if you go to a doctor and he checks your testosterone 4 o'clock in the afternoon, it could be far different than the next day when you go at 10 in the morning. So that's something that you have to take into consideration.
So I want to bring this up sort of delicately. So should guys, as they get older then, are they looking to have sex more in the mornings than they would be at night because they have more testosterone?
Well, you don't need that much more testosterone to be able to perform.
Depends how hot the girl is.
Oh.
Just kidding. And is this something that every guy is going to have to deal with? Because you just said they start dropping by age 30. So every guy that is 40, 50, 60, are they going to need some sort of help, or not necessarily?
No, not necessarily, because a lot of it has to do with how healthy you are. For instance, if a guy has diabetes, he's probably going to have more problems. If a guy is obese, overweight, if a guy is smoking cigarettes, a heavy drinker, all these things have an impact on your general health, and it's going to sort of worsen whatever testosterone deficiency you have. So the bottom line is, if you have a healthy lifestyle, your slow decrease in testosterone, you're not going to really notice it.
Dumb question, but why not? Food, does that matter? Like certain foods give you more testosterone or anything like that? Diet?
Not really.
No. Okay.
Not really.
Okay.
Some people would say certain diets, vegetarian, whatever, but it really hasn't been proven to really matter that much.
So for all the women watching, I want to circle back to the female perspective on this, because I know that you were telling me that women sometimes come into the office with their partners to talk about it. So we're going to get back to that, because I know there's plenty of women watching with questions as well. I want to talk about ED, erectile dysfunction, and same sort of questions, symptoms, ages, causes, things like that.
Well, again, like I said earlier, overall health is very important. A man who's diabetic can start having erectile dysfunction in his 30s. A man who's obese, who drinks a lot, who smokes a lot, can have problems, because basically in order for a man to get a good erection, you have to have enough blood flow going into the penis. So it's a matter of blood flow. I probably sound like a commercial for one of the drugs, but that's the way it works. And so if you don't have good blood flow into the penis, you're not going to have a good erection.
Okay.
In fact, as a urologist, we're told that if we have a young guy in his 40s who comes to us and has erection problems, we should probably send him to a cardiologist, because if he doesn't have good blood flow to the penis, he's probably not going to not having good blood flow to the heart. And that may be, sometimes erectile dysfunction in a young man is the first sign of heart disease.
Wow.
So there's a direct relationship there.
Where do you come in on Viagra, Cialis, all those?
I think they're great drugs, and in fact, Viagra was actually discovered accidentally. It was being developed as a heart drug because it acts similar to a drug called nitroglycerin, which dilates blood vessels. And they found that it dilated blood vessels, but selectively in the penis as opposed to everywhere else in the body. And that's why it works so well. And that's why if you read the commercial or see the commercials or the literature, you cannot mix nitroglycerin and Viagra, Cialis, Levitra for that reason.
Those commercials have 35 warning signs and symptoms.
Well,
and what this 4-hour erection thing, does that happen?
Still waiting to hear about that one. No. The only time I've seen it, because we cover emergency rooms, and in the past several years there was one guy who I think was using other drugs, cocaine or something, mixing it with Viagra, and it was only like 20 years old, so he had a 4-hour erection. But for most normal situations, I tell guys don't worry about that because it usually doesn't happen.
Yeah, no, that'd be a weird problem to deal with.
Yeah, it's believe me, after the 35, 40 minutes, the men are not happy.
No, gosh, no. Okay, and then you were telling me earlier that there's surgery if all else fails, if all else doesn't work, right?
Well, the 70% of men will have a response to the drugs, typically. That means 30% doesn't help them. So what do you do? And one thing we do, which we do, is called injection therapy. We can actually take medication with a small needle, inject it into the penis, causes blood flow to increase in the penis, you get an erection. So every time you want to have sex, you give yourself a little injection. It's not as terrible as you may sound, and men can do that. If they don't like that, then we can do what's called a penile implant, which is an artificial device placed into the penis that simulates an erection. And it works quite well, but it is an operation.
That is for low testosterone or ED or?
ED.
Okay.
That'd be ED.
Okay, gotcha.
That'd be ED.
All right, so let's talk about women and their role in all of this. This is tough for a couple. I'm sure it's embarrassing for a guy oftentimes, I would think. But women sometimes are the impetus behind guys coming in to see you, right?
Yeah, I have many, because as a urologist, we treat men and women. And so I have women who I'll see, let's say they've had urinary tract infections or kidney stones, and they're in the office. And what we do in our office to try to help facilitate this, because a lot of guys don't want to talk about it, we have a lot of brochures. So you walk into our office, we have brochures, and typically a woman will pick up a brochure about erectile dysfunction, bring it home, show it to the husband, and then call up in a week and make an appointment and drag him in.
Yeah. It's nice to, I would imagine, for couples to be able to overcome this, because this is the kind of thing that could sabotage a lot of relationships.
And our practice is based mostly in Delray Beach and Boca Raton. We have a lot of retirees.
Right.
And you'd be surprised what they're doing.
Oh, yeah.
Oh, yeah. Oh, yeah.
They're not just playing shuffleboard.
Well, they go to the early bird special, but they want to get home early for a reason.
Leaving them plenty of time.
Amen.
Right. Dr. Yore, so great to have you here. Thank you so much for coming in.
My pleasure.
When we come back, Dr. Paz is going to answer your questions, including, is it weird if a partner wants to bring a third person into the bedroom? That is a real viewer question. That is coming up. But first, here is Matthew Herron with yet another reason why his girlfriend hates him in a segment we call My Bad.
My bad.
I am so tired of every single woman I see trying to get in my pants. I can't even go to a freaking Starbucks without having to tell every woman there, my eyes are up here. I guess it's really not so bad, I never pay for drinks, but it's really annoying when my girlfriend's incessantly trying to get me in the mood. I just hit her with a couple of my go-tos. I have a headache, I have to be up early, or I have my period. Unfortunately, this ranks as number 6, why my girlfriend hates me.